thank you to all of you for sticking out till the end. This is joint work with Christoph Kombemal and Ramaya Krishnan, my colleagues at CMU. So the idea for this paper started about a year ago when we started to read things like this, which I'm sure we all seen, which is, oh, look at this. An LLM can write proof in the form of a poem. Now, this is pretty neat, much better than what I could write. But then again, I'm not a poet. So the question started to come about, which is, well, how good of a poem this is. Things got a bit more complicated because then you start realizing that while I don't make poems as proofs, there are people out there that do. And a very similar poem, popped up on Reddit like 8 years ago, and there were many of these. This is the same proof of Euclid on the number of primes. So the question would be now, well, let's move 5 years in the future. What would be this poem? What would they look like? So the question that we now address here is a bit more general, which is, let's think about output, even creative output, connecting to the previous talks. How would it look like in 5, 10, 15 years? And what we're interested in is not only about the amount of output, but indeed the quality of output itself. So in this paper, this is a theoretical model, by the way, and I'll keep the theory part as minimal. But what we're doing is starting to think a little bit about, adoption and quality choice. Mechanically, we're going to build a model here where there are workers in AI, and something that we're going to think about in terms of thinking about output as raw quantity is like, well, let's add a quality component. Clearly, Euclid's proof as a poem has a bit of a different quality than something that Shakespeare could come about. What we are also starting to think about, and here is where the nature of the AI comes really full-fledged, is that well, the output that we create today is going to be an input into the future. So this creates now a dynamic link over time. And finally, this is something that as an economist it might be obvious, but when workers think about using a technology, especially for AI, then they have a choice, which is this a tool that helps me for quantity, or is it a tool that helps me for quality? By the way, whenever you say quantity, you can flip it and think about time it takes me to do something. You don't need to make more widgets. You can only spend less time doing one. As you can see, this paper, if you have to remember a word of it, I highlighted everywhere. Quality here is really important. So in what we're going to show you in the rest of the presentation, we're going to talk about who adopts and why, and what are some of the conditions on what happens to output over time. All right, this is the most important slide. If it's nap time, so if you fall asleep after this, that is okay. First, adoption patterns. There are some things that are obvious. If you're a low-quality worker, you're going to adopt it because it's going to be a boon for your quality. You can now do better. If you're extremely high quality, then you will not adopt. But what is interesting is there is a middle ground of workers that suddenly, even if the AI is lower quality of them, they can adopt and trade off quality versus quantity. This is going to be something that I'll discuss a little bit later on. Something that happens interestingly, here I feel like I came up with the title before the rest of the paper. AIdiocracy, and it's a reference to a well-known movie, is an outcome that could emerge. Remember, here is a dynamic system over time, and we might end up in an environment where the average quality of stuff is the same or deteriorates over time. We call that a idiocracy stage. And the problem here is that we now start having a lot of low-quality artifacts floating around. I'm an economist. I write a lot of theory models. So here also a contribution of this paper is trying to a bit bridge the gap, which is how could we have a model of things that are very familiar to us, like training of an AI or an adoption of an AI. So we do a little bit of progress there. All right, let's do the theory. I'm going to limit the math. So this is a dynamic model. The dynamical system here is the distribution of tokens. Think about what we're going to use the AI to train off. And there are agents that make choices. Agents are not all the same. They're going to be distributed in a one-dimensional quality. The agents have a couple of choices they need to make. First, I could say I'll ignore all of this AI stuff, and then I'm going to go as business as usual. Business as usual still has, well, how much do I produce and what quality do I produce? And notice that this feeds into the what is available for us in the future. But I can also now combine my effort with the AI and do the same choice. How much time I use the AI, how much time I use, and how quality I use. AIdiocracy is a state where this state over here is of lower average quality than what we started to begin with. Notice that if you're an economist, there is an interesting problem here. We usually collapse everything down to a one measure, how much capital we have. We can do that because we can aggregate the quality of capital. This is a nice building. You know, that building over there is not as nice, but we can sum them up because of different value. With data, that's not something I can do. I cannot create what is the total value of data out there, or at least not yet, but something we should think about. Okay, so let me start thinking about some of under the hood. I just want to emphasize some of this. At the fundamental level, you might suspect this. There is some substitutability. So for workers, there is, they can put in time, they have their own skill level, and there is some degree of substitutability between these. This enters a bigger production function once the AI is involved, and there is some different degree of substitutability. I want to show this because there is something else we can do with this theory, which is now suddenly these are identifiable parameters. These are things I do not know. How easy it is to substitute my own quality with the quality of the AI. Once we have a structure, we can estimate it. This is under the hood what the time-quality trade-off appears. The results are written for a general set, so we can be pretty precise on what happens. And let me start with the basics. And I promise this is the last equation I will show you, but this is going to be an important aspect because in this environment, the moment workers have a choice, what's going to be important are two things. First, the level of prices, and the level of prices is going to pin down how much you work. Earlier we saw the artwork presentation. The average price of a painting will depend how much time do I spend making painting as a whole. But notice there is something else here going on, and this is just the slope of prices. So the question will be of interest, which is, if my painting was marginally more creative, marginally better, how much more money am I expected to bring in? The slope is going to be important because this is going to pin down, do I spend time create one more painting, or do I spend one more hour polishing up my previous painting? So all of this paper, I guess is basic economics, which is the slope of price are really important. The rewards are really important. This should not be too mysterious to all of us. Let me give you a bit of an idea on a bit more of the details here. Let me rank all agents in a straight line. What we see is pretty obvious, which is there will be an indifferent agent, and people who are really high quality, they will not have much of an incentive to adopt the AI. People who are really low quality have an incentive to adopt AI. This is obvious. This is not obvious. There is a region in between where even if the AI quality is below me, I will adopt. How can I be? Why am I using something that is worse than me? Well, then the incentive here is I'm going to lower the quality, but I'm going to spend less time on my work. I'm going to perhaps introduce more widgets. So this is something that in all the last day and a half, we've looked at many presentations where adoption is taking place. One question I had repeatedly was, well, for the folks who are using these tools, how are they using it? Is this saving time or improving quality? That's an important trade-off. What matters, and once again, is the slope of price. This region is going to grow more and more depending on how flat the prices are. This is also should be intuitive. I like to make the analogy with in academic world. In the academic world, the rewards for your work are extremely convex. You write many papers that are marginal, you get no reward. You write that one crucial paper, you get tenure and you have this convex reward. Meaning that this is an extreme case where, in academics, you probably not have many people in this region that are willing to, oh, you know what, let me create more junk papers and see if that improves my odds. The prices would say that that's not going to happen. Okay, let me say something about the dynamics of it. We are starting to see lots of articles out there about the increase of output created by AI that's polluting what is out there. I guess here we have, this gets a bit more technical, so I'll keep it a bit in more words. But is it true that is there a state where average quality declines over time? Yes, it depends. And here will be a question I would like to ask on folks who are more into the machine learning side of this, which is in the model, I'm allowing some flexibility, which is, what does matter for future training of the AI? Is it quality or quantity of data that matters? The models allow for both. And, in some cases, you can immediately see what is the problem. If there was only quality that matters for training of the AI, then we have a problem. Because now we start having that, low-quality agents are going to swamp the training set with low-quality output. We're somewhat in between, so now we start having a region where, okay, it's fine if the quality created goes down, but as long as there is not too much output being created, we are on the safe side. I'm not going to put the technical condition. I can show you just a basic simulation. And here on the two axes, I put the two things that matter. On the vertical axis is how good this AI is. Think about different versions of ChatGPT. On the horizontal axis, I put something that perhaps is the novel contribution, which is how steep are prices. Over here, you have prices that are flat, and over here, you have really convex prices. Some of things here are obvious. If the AI is bad, you're not going to use it. As you have better AI, more and more usage gets in. But notice that there is this region over here. If prices are really flat, nobody's doing any work in terms of quality. Now, if I increase a little bit, now you start having people who trade off quality for quantity, and you start having lower quality overall. All right, I have less than a minute. Let me wrap up. I took a picture of the very first calculator I remember buying, which I still use. And, here I want to talk about the analogy because it's easy to think about AI as just another tool. Calculator helps us do stuff. AI can help us too. But here is where the analogy breaks down. If you think about a calculator or a drill, it helps me do calculation. It helps me make holes. But I never think about, does it make quality of my multiplication? Does it go up? Do my holes I drill in my wall, do they get better? That makes no sense. It's a statement about time. But now with this technology, what's different is that now there is a trade-off. Is it quality or quantity? All right, I'm done.
Do you have any questions?
Sure.
So there was that plot you showed earlier, the line of adopters, non-adopters, and different.
Yeah.
How will that shift across time? Because I think you basically showed that in a plot over there, but can you describe how that would shift as your adoption increases?
Yeah.
You expect a lot more.
You should think about the AI overall quality. If the AI quality were to decline, that line moves to the left, and this one moves to the left too. So if we're in an environment with AI quality increases over time, you have both these two segments moving to the right.
But like in terms of the agent quality, do you also have?
Oh, the agent quality is not. We don't have human capital accumulation. That would be, a fascinating thing to add. At the moment, the only thing that changes quality over time is potentially the AI.
Yeah. Okay.
Yeah.
Is there a possibility that people will use AI to generate high quality content?
Oh, absolutely. So this it depends for the slope of the prices. So definitely think about that. All of these people here, these are people who are low-quality workers that now are empowered to create high-quality output. There is that in place for sure.
So I have a question about the AI training you posed, right? So for large language model, it's about next word prediction, right? It's really about the quality of understanding the language. What will be a AI model look like? They factor the quality and the quantity in a large language model scenario.
Yeah, so I did not show, but under the hood there would be, let's see, this is how the AI works. You should think of this is like a Cobb-Douglas production function. We can allow other substitutability, and now we usually think about only quantity matters in creation of output. Now we can put a variety of moments. It is average quality of the output. Going back to what I do not know is these alpha and beta parameters. How important is the number of tokens and the quality of tokens in creating a quality of output of AI? I do not know that. I don't think we do know, but that would be the next step.
Thank you.
Thank you so much.
Okay. Hi, everyone. Thank you for staying until the end of the conference. I appreciate it. My name is Nick. I am a PhD candidate here at Penn, and I am defending my dissertation in about 3 weeks. And I'm going to be talking to you today about some of my dissertation work that I've done over the last couple of years. And I just want to note that there's also pieces of this work in here that are collaboration with other authors as well. So first, just a quick rundown on what I'll be covering today. First, I want to be talking about some background on what I'm going to be calling automated data labeling. And then I'll describe some challenges and concerns with this type of technology when we're applying it. And then I'll describe a potential framework that can be used to help alleviate and address some of these concerns. And then finally, I'll describe some experiments that I've conducted testing this framework and really trying to take stock of whether this is a technology that we should be using and how we can be using it. And then I'll come back to some of the main takeaways at the end. Okay, so before I talk about automated data labeling, I want to just at a high level talk about manual data labeling. So as people in this room are probably aware, machine learning practitioners across industries and applied research settings often rely on high-quality, manually labeled text data for training and for validation of supervised and semi-supervised language models. And then, as we're also aware, these models are deployed for a variety of purposes, ranging from text classification, customer support services, and more recently, a lot of emphasis has been placed on information retrieval. And the typical workflow for manually labeling and using these types of models involves this first stage here of having a human read a subset of the data and categorizing it into conceptual categories of interest. And then the second stage of taking a statistical model and generalizing the human labels through a broader set of collected data. And we can use this approach to label hundreds of thousands, millions, maybe even billions of text samples of interest. So this is a major advancement in natural language processing over the last 10 to 15 years. And as generative AI takes, industry and applied research by storm, a major application that I think everyone should be aware of and considering is something called automated data labeling. And so the core idea of automated data labeling is to use a generative language model for automating the manual annotation process. And what I'm going to describe is that because these models are so effective at quantifying natural language, and because they're very easy to use, and they're fast, and they're really cheap, it can be potentially preferable over a manual annotation process. So the core idea is to replace manual annotation with something that I'm going to call few-shot in-context learning with generative LLMs. So if this was our typical workflow that we're used to working with, what if instead of having a human read the initial stage, we said, let's not do that at all, and let's have a generative model conduct the initial stage of labeling a subset of data, and then maybe we build a statistical model on top of that data. Or perhaps we just have the generative model label the entire text data set that we've collected. So what do I mean when I say few-shot in context learning? Essentially what I'm saying is that we want to take the text annotation instructions and use them as the prompt input in the generative model, and then reframe the annotation task as a text classification problem. So again, just to kind of reiterate this, we're going to take annotation instructions that specify how to classify different text samples into pre-specified categories of interest. We're going to concatenate those instructions with different strings of text examples, and we're going to combine those together and use that as the input prompt for the generative model, and then we're going to have the generative model categorize our text data for us. So I think at this stage it's worth asking, why is this something that we might want to be doing, if it's not immediately clear? If you've ever worked with human annotation procedures at all, you know that it is extremely time-consuming, it's very expensive, and it's prone to a variety of errors. Humans have shortcomings, they have limited attention span, they get tired, they make mistakes. It sucks. If you've ever done this, it's a horrible, horrible process. I encourage you never to do it. If you can, it's brutal. Generative models, on the other hand, they're much faster than humans. They're cheaper than humans. And it's possible that they're more accurate than humans as well. And potentially the greatest advancement is that we don't need any training data to get started with automated annotation with generative language models. Right? So unlike supervised classification, we can just get started with our annotation procedures by just describing the conceptual categories of interest. So what's not to love about this approach? Right? This is something that automated annotation, data labeling, this is a billion-dollar industry. This is something that industries are already using pretty much across the board. But there's some serious concerns that I have. Automated data labeling involves identifying latent concepts in text. And if we start using generative language models for automated data labeling without any type of validation, then we just have to assume that our automated annotations are aligning with the concepts that we think we're measuring. To put this another way, if we don't perform careful validation, then we risk generating inaccurate labels that could potentially lead to mismatches between the theoretical understanding of what we think we're measuring and what we're actually measuring. And this mismatch could negatively affect downstream applications and analysis. And so these concerns lead to this framework and this question. How can practitioners responsibly and effectively integrate generative language models into automated data labeling workflows? And one of the main arguments I want to try to convince you of today is that automated data labeling must fundamentally remain grounded in human judgment in some way. If we don't have any type of validation data, researchers are going to have no way to discern model performance and identify potential theoretical mismatches. And really the implication of this is that humans should not be completely removed from automated data labeling procedures. Okay? And one key type of validation that we can do, there are many types of validations that we can do, but one key type is to have human annotators label a small subset of text data that will serve as a validation set for the generative model. So just like any machine learning system, we want to make sure that we're validating this in some way. Okay? And here's a figure describing the workflow that I just described. In the first step, we're going to create task-specific instructions that will be used by both the human and the generative model. And then we're going to validate whether the human and the generative model are aligning on their annotation decisions for a small subset. Maybe in a third subset, we can conduct some type of prompt engineering. And then in the fourth subset, we're going to perform another test of the generative model's capabilities and compare to what the human labels are as well, to try to understand, are humans and the generative model aligning on their annotation decisions? So what I did was I collected 11 data sets from recently published articles in high-impact journals that included some type of manual text annotation procedures. And I'll skip over this for now, but there was a specific reason why I chose published articles, and the high-level reason is that they are less likely to be included in the model's pre-training data. And then I wrote code in Python to query GPT-4 to conduct automated data labeling for these collected data sets. And essentially what I did was I replicated all 27 of manual annotation procedures from these 11 collected data sets and compared what GPT-4 annotated with what the humans in the original study annotated as well. So I could determine whether there was convergence between what the humans annotated and what the generative model annotated as well. And so these are some of the papers I drew from and some information on the tasks. I'll skip over these for now. And the high-level results that I want to just kind of quickly draw your attention to. So these are performance metrics on 27 tasks from 11 articles where I'm replicating the annotation procedures in those studies. And the first thing I'll draw your attention to is the median accuracy here. We can see that it's 0.85. That means that 85% of the time, GPT-4 and humans agreed on what the annotation label was for each text sample. That's pretty good. And then we can see that the F1 score, the median F1 score is 0.71, which means that the model's pretty effective at identifying true negatives and true positives as well. So as a whole, I would say that that's pretty good median performance. And I think that that's one takeaway from this. But another takeaway is kind of the lower bounds here. So we can see that the minimum F1 score is 0.06. And on this slide here, I'm going to give you some more granular insight into the tasks here. On the y-axis, we have recall, and the x-axis, we have precision. And really what I want you to take away from this is that there are a significant number of tasks where precision or recall is subpar, right? About 9 of the 27 tasks have strong precision and recall. Those might be situations where we want to use automated annotation. But there's a huge number of cases where humans and the generative model do not align. And we would not know that if we hadn't tested against what humans had annotated previously. And I think that that is a concern if people are using automated annotation without validating it against some type of held-out human setting. Okay, and so this is just highlighting some of the things that I'm saying. And again, just to really reiterate this main takeaway, despite some strong performing tasks where automated annotations did align with humans, there's a non-trivial number of cases where the automated annotations diverge. And so grounding automated data labeling in validation labels generated by humans is essential for responsible evaluation. I'll skim over these now, but there's a large number of additional analyses I've done, like comparing automated data labeling to more of a supervised approach. I've also quantified the effects of prompt optimization or prompt engineering to try to understand how much we can improve performance by adjusting the prompt. And then I've also compared GPT-4 to an open source, a smaller open source alternative. Okay, with the last 40 seconds or so, I'll just recap some of the main takeaways here. I think automated data labeling is a really powerful tool that should be implemented into text as data methodologies. Given their speed, their low cost, and their ease of application, it's really tempting to use these tools without any comparison to humans. Right? Again, if you've used human annotation before, you understand what I'm saying. But if practitioners deploy these tools without validating their performance, you risk inaccuracies and bias. And what my findings underscore here is the necessity of a human-centered framework in some way. And the question that I want to leave you with is, how can we validate automated data labeling procedures when it's difficult for humans to generate validation data? And I'll end there. Thank you. Yeah.
So you qualitative researchers will code textual data interview data and the like. So outside of using, this is like labeling data for a subsequent model. Is this kind of the starting point of what a qualitative researcher might use to codify text data at scale?
Yeah, so a lot of this framework came from qualitative social science, actually. Yeah, a lot of the ideas for this came from, and I think that the prompt describing the conceptual categories, the reasoning and the way to structure those comes directly from content analysis from qualitative social sciences. And so I think that they're directly connected, yeah. Yeah.
Did you analyze, so you say that there were like a class that were pretty, that you showed like really high match between human coders and machine, and there were like a type of, things that you didn't see you see the mismatch. So did you analyze what are the characteristics, what are the like defining characteristics of these mismatch?
Yeah, great question. So some key giveaways for a mismatch were really poor human intercoder reliability. So a first step is just validating that humans are doing this correctly. And there were only a few cases, some of the worst performing models that we are alignment between humans and GPT-4 was when there was really low human intercoder reliability, which potentially suggests that maybe GPT-4 is doing a better job there. So that was a giveaway there. But kind of more qualitatively, I would say any task that relied on kind of nuanced cultural knowledge, it really struggled with. And these were hard. These were 27 tasks that were really difficult. These were not simple summarization tasks. They were really nuanced tasks. Yeah.
What percentage of the labels were done by humans, as their, like your model training and test set, if you will, or as long as it has some data to learn and you exceed that threshold, can you like essentially automatically label infinite amount of data?
I think your question involves. So is your question saying if we have enough human labeled samples, can we build a supervised classifier? Is that what you're saying? Or?
No, what is the minimum threshold? Like how many labels does it need to see that were validated by humans before?
Oh yeah, great question. And I think it partially depends on the positive class frequency. So what I did was I had a validation set of 250 text samples to optimize the prompt, and then I had 1,000 text samples that were completely held out, and I tested performance on that. But I think it totally depends. If you have a 2% positive class frequency, then you're not going to have many, even 1,000 human labeled samples might not be sufficient. But yeah, it's a good question.
One last quick question.
Yeah. I did something very similar a few months ago using a few shots prompting. So my question is, have you done any analysis on how many shots you have will have a certain impact to the final results? To me, the longest prompt after the few shot is close to 1,000 tokens already. And that has a huge impact on the cost if you're trying to use that to label, let's say, 3 million tags. So I just want to know what's your take on that.
Yeah. So I'll say two things quickly. The first thing is in regard to cost. So I have a separate paper that involves, if we go back to the right here. Oh, it was much further back than I thought. Using a generative model to create training data to fine-tune a statistical classifier. This is something called knowledge distillation. I have another paper on that. So if you're concerned about costs, this is a method that works really well. You only have to label about 1,000 text samples using the generative model, and then
we did that too. Yeah.
Okay, yeah, we found that it worked pretty well. But to the second question of few shots, we didn't necessarily test like adding specific examples, but what we did instead test for was just clarifying conceptually. So what we did was we labeled a subset of 250, and then we manually looked at all the incorrect classifications and said, oh, okay, the model is making this mistake. Let's update the code book, the prompt instructions to adjust there. And we've actually started moving away from the zero-shot, few-shot distinction because it's I don't think it's very accurate to say because it's a lot of times just refining the prompt as a whole, and reviewers have kind of pushed us more towards just saying in-context learning because it's all just in the context of the prompt. But yeah, interesting question.
Okay, thanks so much.
Thanks.
As we switch slides, I'll just introduce myself. So my name is Hatim Rahman. I'm a faculty member at Northwestern University. My research is at the intersection of technology, work, and organizations. And in the Q&A, kind of set it up. I am primarily using qualitative methods to study. And so I think we're about to get up the slides there. The project I'm going to present today is in collaboration led by my PhD student, Jody Ko, and another collaborator, Sarah Lebowitz at UVA. So the title of the presentation is Beyond Data Collection, Examining Artificial Intelligence Data Creation in Organizations. So I wanted to start by, one of the reasons that got me motivated and excited about this project is thinking about what's theoretically new about AI. The reason I bring that up is if you think about automation, broadly speaking, that's been going on for decades in factories, in agriculture, other types of settings as well, right? So I think there's two-part answer to this, at least from my analysis. One is the extent to which AI can act autonomously and make decisions in real time when encountering new situations, right? So unlike automation in factories and others, right? If something goes wrong in the line, the automation would break down. But generally speaking, what gets people excited about AI is its ability to act autonomously when encountering new situations. The second part to this that I think is really important is that the ability for technologies to autonomously learn and act is contingent upon the data it's trained upon. Not my area of specialty, but generally speaking, my understanding is that neural nets, LLMs, theoretically, those algorithms existed from the 50s, 60s, 70s, 80s, right? But the access and the reliance on data has exponentially increased. So we've seen, right, lots of studies have come out and talked about the data and systems it trains upon determines its impact in hiring, medical diagnosis, text and image generation. A lot of people's presentations through these past 2 days have also have similar types of implications. And just to emphasize this again, we're all talking about Gen AI. We've seen OpenAI more or less come out and say that without access to copyrighted textual data, their model wouldn't be able to perform at the levels that it has today, right? So again, we see data really at the center of AI's proliferation and its ability to perform. And so just an overview for where I'm going to go, we're going to ask in this paper, how do organizations manage data for designing AI systems and with what consequences? So I'm going to emphasize design here because a lot of literature in my field looks at how people interact with AI and use AI, which is really important, no doubt about it. But we're kind of going, shifting upstream and looking at the design of AI systems. So I'm going to present some current literature that broadly looks at how design works broadly in AI as well, focuses on what people call technical data work, such as cleaning and annotating data. And again, a lot of people have talked about this. And the way that we're going to study this is through a 16-month ethnography of a healthcare organization developing an AI-driven handheld ultrasound probe for use in low and middle income countries. I'll talk about it a little bit more, but this project was motivated by the fact that in a lot of countries, people don't have access to healthcare. So one way to reduce fetal and inpatient mortality is to increase access to ultrasounds. And so the thought was you can use AI so that people could scan a fetus, and the AI would then make predictions about the health of the fetus so that people could potentially go and access more healthcare if needed. So the main finding that we present is that in terms of how organizations manage data for AI design, it depends on the extent to which existing organizational practice produce data. So there are a lot of systems, EHR systems, other things like that produce automated data, especially on online platforms, right? They're already producing a lot of data that can very easily be used for AI, machine learning and AI training. And how practices must change to produce data. So the point here is that what I'm going to show you, especially in the healthcare setting, a lot of practices in healthcare are not producing data in a format that is accessible for AI. A lot is, but there is a lot that isn't as well. And what I'm going to show you in a little bit is a lot of our data looks at how in a healthcare bureaucracy, they try to change to be able to gather data for an AI system, right? I don't think I'll have time for it, but an interesting thought that we've had in this paper is that a lot of times bureaucracies, especially in healthcare, are optimized for efficiency. And that works well in terms of lowering costs, but as we talked about, especially when it comes to designing AI, a lot of times you need to create new processes and change workflows, which aren't necessarily aligned for optimizing efficiency. Okay, so brief on literature review, just in terms of conceptualizing data, a lot of researchers also treat data as factual information used as a basis for reasoning, discussion, or calculation. Just mentioning this because a lot of social scientists do discuss about how data is actually a very subjective process that involves a lot of decisions that get obscured just when you get the quantitative data. But in terms of thinking about the importance of data, we saw this metaphor arise when big data came about, how data is the new oil, waiting to be extracted, refined, and used in AI systems. And so one initial insight that we had when you look into some of the literature is just as oil independently exists, waiting to be extracted, a lot of times people, especially organizations, think about data to exist independently in the world, waiting to be collected, refined, and used to train AI systems. But again, a lot of our data shows that this isn't necessarily the case in our setting. So Shoshana Zuboff, in her book Surveillance Capitalism, has this one of probably thousands of very memorable quotes, where she talks about, as a result of pervasive computer mediation, nearly every aspect of the world is redefined in a new symbolic dimension, as events, objects, processes, and people become visible, knowable, and shareable in a new way. The world is reborn as data. Right? So she also talks about, essentially, in our new digital era, everything that we do is being kind of consumed in these data systems for training. So data work, which is a term that many social scientists have talked about to describe what it takes to get data ready for AI systems, again, tends to emphasize the technical work that it takes, right? So again, in the previous presentation, talking about annotation, extraction, cleaning, and preparation. So Mary Gray and Suri's work talks about how organizations often outsource this work to MTurk or other micro platforms. And they talk about how this is ghost work because a lot of end consumers in organizations don't necessarily see the workers involved. So broadly, we would say that our read on literature is that data work is seen as a linear, finite accomplishment involving a relatively narrow set of stakeholders, so gig workers or technical workers within an organization. So briefly, so I can get to our research design and data, the literature and technology design does kind of hint at, as it relates to trying to create new data or produce new data for AI systems, trying to pay attention to cross-boundary occupations or the occupations involved in creating, collecting that data is going to be very important, particularly when there's differences in expertise, status, and power. Okay, so research methods and that I'm going to go over here. So one that I mentioned, the kind of the motivation of this project is that a lot of low and middle income countries don't have access to advanced healthcare, and this is particularly acute as it relates to maternal and fetal mortality. So these are some of the numbers that you can see here. So the project that we got onto, their thought was to expand ultrasound imaging and care in low and middle income countries by enabling more providers to deliver care through developing AI technology to automate the diagnosis of key point of care findings. And so this is the actual probe that would be used on the project. So again, the idea is that somebody could scan a fetus, it could be a midwife or even the patient themselves, and then the kind of the predictive AI models would then tell you the gestational age and other types of outcomes that could potentially trigger somebody to seek more care. Okay, so again, my PhD student on this project led an ethnography of this project, and what really got me interested is when we entered this project, they hadn't decided on which outcomes they're going to predict yet, right? We got to observe them thinking about, like, what should we predict? Which data should we collect, right? So that's kind of where we entered into the field site. For the sake of time, I'm going to keep going here, but this is a very common process that's followed with qualitative inductive analysis when we're trying to generate theory as opposed to test theory. So broadly speaking, sorry, this is not very well designed here, but what we do in our findings is talk about 4 different types of data work. So extractive data work is what you see, what a lot of literature talks about, which generally assumes that data exists in a way that is readily accessible for AI systems. And what's generally needed is an annotation and cleaning, right? And then again, for the sake of time, what I'm going to show you data on is what we call expansive data work, where currently the organization is not producing data in a way that's accessible or usable for AI systems. And they have to do a lot of changes to their organizational practices to be able to collect that data. And again, the quotes that I'll show you here will illustrate that. So one thing I wanted to highlight here, one of the reasons why this project got initiated is that the hospital that we're studying is responsible for 1% of the newborn population in the country. And so there's this thought that they would have unlimited patients, right? That the data would be there, and that they were initially approaching it would be kind of an extractive process, right? Where all they would have to do is kind of access the data and then use that to train the model. But what quickly ended up happening is that they realized for some of the outcomes that they wanted to measure, you need fetal scans from all weeks of the patient's progression through the pregnancy, right? So you don't just need a 20-week scan. Ideally, you need a 37th week scan. You need a 17th week scan. Right now, in the U.S., most hospitals, the only high-quality image scan that could be used potentially for an AI training model, according to our informants, was a 20-week scan, right? So they realized, especially if they wanted to predict rare outcomes, which is the goal of the project, right, to potentially predict rare outcomes to allow patients to access better care, they realized that they would have to kind of tap into those unlimited patients and create new fetal scans. Now that process was very involved, right? So one of the things that happened was that one of the research nurses says they had to now get clinics on board to be able to collect those scans. So she describes the process as that they had to talk to the medical assistants in these clinics. There's leadership who the doctors and researchers must develop relationships with. And then the research will shadow the MA to come up with some ways in which they're able to access the patient pool in these sites to collect data from, right? So this is a very involved process. I'm just showing you a small quote, but this took months to figure out which clinics, they're in the hospital system, but which clinics they can access, and then how to develop the relationships to be able to get some of those fetal scans. So, another quote from our data is that not only they're successful because she's built a good relationship with all the staff to a point where they like her and are willing to work with her. So in our data, they talk about how the staff has to kind of tell the research nurse who's going to collect the scan about when a patient's going to come in, right? So that type of situated knowledge only comes through these relationships. The other thing that is obviously salient in the healthcare setting is even if you get into the right patient room and you get to the patient, you have to get patient consent, right? So that also, so it can break down at that point as well, where if the patient doesn't consent, you're not going to be able to collect that data for an AI system. So the last kind of data slide that I have here is that because, again, they're trying to collect this for an AI system training, they use a specialized probe that could collect more detailed image data. And using that required the research nurse to kind of retrain how they normally conduct a fetal scan, right? A normal fetal scan is not done for an AI system. It's done for a lot of different reasons. And so we capture this in our data as well. It's kind of the practices that that the research nurse and the clinicians had to do to change. Okay, so I'm getting the signal that I'm over my time. But this is kind of what we expose in our findings, is these different types of data works corresponds with whether or not existing organizational practices already produce data for AI design, And just one example here. So generally, it's routine practice, for example, to document the patient's age and their weight, right? That's a routine practice that can relatively easily be used to train an AI model versus some of the scans that I talked about, like the 37th week scan. Okay, so I'll leave it there and open it up for discussion.
To give a clarification about the context here. So this handset of scan is relatively easy to use, right? What would it be a complex technology AI design that will be change your diagram for that data or yes, no, yes, this for combination?
If the use of it would be difficult as well?
Yes.
Yeah, that's a good question. So the short answer is yes, I think it would, right? That would add further complexity in terms of determining what type of work you would end up exerting on the project.
My expectation of the leadership, the relationship is even more important in that context.
That's right. And one of the things I want to highlight is that for a lot of organizations who want to get into AI, it's going to require a lot more investment, especially if they want to get models to the extent that they're hoping for. Yeah.
How do you think about the quantity of data needed for this qualitative study?
Yeah, so in terms of the I'll answer that in two ways. One was that was a big thing that we observed in the project, right? That they can't just have 2-3 scans of a 37th week patient, right? They wanted 50, sometimes 200 scans, just to test the model, right? Let alone to scale it up and then get it, potentially in different countries. So that's one. And the second thing is that trying to observe, we wanted to get in early on the project to observe the entire project. And they aren't as far as we thought they would go just because of how long it's taking to even collect some of the initial data. Yeah.
So my sense is once they knew what they wanted to model, they would automatically know what data they needed to collect. But was that true?
Generally speaking, you're going to collect fetal scans, right, for these predictions. The question would be what types of scans you want and when.
You mentioned you have to do it a certain way, for example.
Right. And we did observe them talking through that, right? Like they filtered out certain outcomes. They're like, if we want to try to predict outcome, we need to the head presentation to be like this way and that way, and it's very rare, so we won't prioritize that right now.
So I'm going to propose there's probably a similar mechanism in your paper in mind where the operator of that device is giving useful intel to the data scientist about the provenance of the data depending on applicative technique. Like they create the data and they're going to have the skill and perception to. Do you have that? Does that show up in your data?
It does. It is very iterative between the two. So they think they collect the scan in the correct way, and they'll go back and no, you didn't necessarily. So yes.
But you don't have the data that's telling people asking for data, asking for the wrong data or in the wrong way, or making insights about the device.
I'm having a little trouble hearing you, but I think yes is the answer. Yeah, we can talk more.
Cool.
Thank you.